Hey there, Dr. Amos. How's it going today? How you doing?
Fantastic. Just I think 118 degrees or something outside, but otherwise, doing well in
Yeah,
air conditioning environment.
exactly. It's not so great for the sperm if you were outside, which is the topic of what we'll be talking about today. So, yeah, hope you guys didn't miss me too much last time I was gone. But
We
I'm
missed a little
looking.
bit, but Dr. Durham did a good job. He definitely brought a lot of experience into it. So
Oh, absolutely, Dr. Durman, years of experience, amazing, amazing. Every time I talk to him, you get the iterations of he's like, well, it first started like this, then we did it this way, and now we do it this way. And I just love hearing that from Dr. Durman. It's
yeah.
really cool. Well, we have a really interesting topic today, and I'm super excited about it. And it has to do probably with, maybe like what we'll be calling IVF version 3.0 now, which is all the AI, artificial intelligence assisted procedures that we'll be able to do. And one of the really, really exciting things that is happening in our field is the integration of AI, and we're already seeing some applications for it. One of the first fields in medicine to really kind of start implementing it. Of course, radiology has done a great job with that in imaging, and that's a little bit of kind of what we'll be talking about today, with the use of some of these new AI tools that we'll be talking about that might help some men with severe male factor infertility. Um, so just kind of at a very broad level, I mean, Dr. Amos, you're like our, chief technology officer in house, right? Like, you don't get just to be the founder and the CEO, but you also got handed the CTO ticket as well. And, I know you work a lot with AI. I know you have a deep interest and passion for how AI can integrate into medicine. And I'm just kind of curious, just to kind of kick things off, what your take is on where we're at right now in our field with relation to where, how we can use AI.
Yeah. Yeah. I mean, I think AI is touching all aspects of it. I think in many ways, not just in the lab, but even in our clinics, right? We're starting to see AI be involved in just our communication systems. So AI is not so much doing the work, but making people more efficient. And for example, like even in our new system that we have that does texting with patients, it's going to help answer basic questions. It's going to be able to help route questions to the right people faster. So patients can get their questions answered faster versus having to wait for a human to type and interpret it. It can just catch it right away and send it to the right person. So we're always seeing a lot of stuff like that, and that's kind of algorithmic based ones, that just use algorithms and they're adding automation. But the really cool thing at AI, and we're still not there 100%, is when we start getting artificial intelligence, and that's getting closer and closer, and that's really when we're going to have decision making occurring. But right now, most of it uses large databases, and using that, it can use historical data that we've put into it to make help make decisions. And one area that it has been used a lot in is actually recognition and for visual recognition. Where our eyes, although we feel like we see things really well, the actual focal point of our eyes is very minimal, and almost everything you see is almost like just generated in your brain. And so what's really cool about this is that it's actually looking at everything 100% with fine detail, whereas our eyes can't do that. We can look at a point with fine detail, and everything else around is kind of determined, but we have to look there and go, oh, there it is, there it is, there it is. And so it's really an interesting part, and it's able to, because it can focus on more than one thing at the same time, it can really look at data faster than we can. So I mean, our brains are pretty amazing. I think there was something just recently saying like even the fast computers now cannot pick out a face as fast as a human can. We're still very,
Wow.
very fast. But recognizing is different than being able to look at a lot of data. And that's where it's really good at. And so now you see like, you got Tesla now, which is vision only, having their auto, drive, and now their robo taxi. You got Waymo doing it. And so now we're starting to see it in medicine. You talked about for a second there with radiology, that is specifically humans looking at images. And there's still this part about clinical that's going to take time to combine clinical and vision. But when it comes to the vision, it's pretty dang amazing. And we're seeing that it's catching things better than even humans now. And so again, now using a human and using the AI, they can now determine like cancers a little bit easier, by looking at things, catch things that maybe the human would have missed easily. And so in reproductive medicine, we have AI being used in multiple areas. So I know we have a few areas we're going to talk about. One of them is automation. That's one area that's just going to try to help bring costs down. And so if we can do more cycles with less people, that's going to help bring the cost down. The second area is going to be, diagnostic in the standpoint of, again, using it to help diagnose things, being able to help, stratify patients into what group and things like that. And then the thing that we're talking about is, AI, again, still diagnostic, but looking at from the vision standpoint. And so a couple interesting things I saw coming up that I know we're going to talk about. One, identifying sperm. Two, identifying the best eggs. So even when you freeze eggs, it can let you know that if these eggs are going to be good in the future. Another neat one is, with automation, be able to select the sperm. And then there was a couple other things I was looking at recently when it comes to the AI. I'm going blank for a second. It was looking at from a different perspective. I'm trying to remember the article, but I'll come back to it. Like I said, it was on the tip of my tongue, and I'll go. But there's another area of AI that's coming into play that we'll kind of go into, and I think would be kind of interesting. But what about yourself? I mean, I know that the article you talked to me about, the Time article with a friend of ours, actually Zeb Rosenwax. I was actually on the fellowship trail with him when we were all going to, for all our interviews. And so I met him, and a great guy, super, super smart guy, same name as one of the legendary Rosenwax out there. And so love to hear what you think about everything.
Yeah, no, absolutely. I mean, it is really exciting, right? Like what's happening in this field and the opportunity to, I think, leverage AI to improve outcomes. I think that's what we're always looking to do, like improving our success rates. Our success rates have come a long way, but improve outcomes, increase access, which is something that's near and dear to our hearts. I mean, increasing access by, ultimately reducing the cost of an IVF cycle. I mean, how amazing would it be if we could, push down the costs and make the success rates go up even higher? And then the third thing is, I believe, doing things we couldn't do before altogether. And I think that, what we're going to talk about today fits in that third category. I think it's doing things that we weren't able to do previously. And so I just thought I'd kind of present the idea like a little bit to all our listeners out there. I really want people to come onto the show too and ask questions. And, we're happy to talk about anything. We were not part of this study. We just read about it.
Yeah.
And it happens to be that these are our colleagues and friends who have done it out at Columbia University. But basically this technology, it's called STAR, Sperm Track and Recovery, very clever. And they are using this technology for men who have azoospermia. So let's take a step back and let's start talking a little bit about, male factor infertility and how that really ties into this tool. Because I think this is a good time for us to kind of review some things about male factor infertility for a lot of our viewers here today. One of the things that goes forgotten a lot of times is the guy, just the guy's part and the sperm's part. And ultimately, the genetics on the male front are 50% of it. And when you think about cases of infertility, we believe that as much as 40 to 50% of all cases of fertility at least contain a male factor issue. And as much as 20 to 30% may be almost primarily or entirely a male factor issue. And one subset of those male factor issues, or the thing that's completely a male factor, is something that's called azoospermia. So azoospermia, to just kind of boil it down to a general framework, is you do a semen analysis and you don't find any sperm. You look under the microscope, you have a very well-trained andrologist. They've looked at thousands of semen analyses. They go on there, oh my God, there's no sperm. And of course, that comes as a surprise to many couples, many men, because there is an ejaculate. There's fluid that comes out. But within the fluid, there's no sperm, because of course the sperm comprises less than 1% by volume of that whole ejaculate. And so that can be a kind of something that a lot of people are initially confused by. But when we look under the microscope, under high power, you can usually find millions of sperm. And, for many men, that's in the tens of millions range for, I would say the variance across kind of like a normal group of guys that have normal fertility. And then it can drop down to the low millions for some guys with, some factor of male factor infertility, where you can do IVF, but you're just picking out the sperm. But then sometimes it drops down extremely low. And that's these cases of effectively azoospermia. There's no sperm in the ejaculate, but that doesn't mean there's no sperm in the testicle. So then we have these wonderful doctors, reproductive urologists, a huge shout out to all of them that are out there. And they go and very carefully get tissue from the testicle in areas that they believe sperm production could happen. And then again, we have our super trained andrologists, and sometimes they'll spend hours. I don't know, Dr. Amols, what's the longest you've heard of an andrologist, looking at a specimen? I feel like hours, like many hours I've heard.
Yeah, I mean, we're very fortunate to have a lot of embryologists, right? So, we can put 2, 3 on it and, get it done within a few hours. But I mean, when individually, I mean, it could be 4 hours, and so it's a lot. There's actually a really funny TikTok that we have on ours where the embryologist, it says one of the downsides of the job is she looks up and her eyes are cross-eyed from looking in the microscope for so long. And yeah, it was about the most I saw is 4 hours, but I mean, I can easily see someone going more than that if they don't have multiple embryologists to help them.
Yeah, exactly. And so this new tool, this is kind of where this new tool comes into play, which is called Sperm Track and Recovery, START, was developed using approaches very similar to what astrophysicists use to find new stars and planets. And when we talk about finding sperm in a testis specimen, we basically talk about finding a needle in a haystack. Well, they take it, one level higher, and they say this is like finding a needle in thousands of haystacks. And it really is, because you have such a low number of sperm that you would have never been able to find it before, maybe. And here, this tool, this AI tool, very gently can find it in a fairly reasonable amount of time. They said a couple of hours is kind of what they were reporting. And then, of course, you take that sperm and you fertilize the egg, and very hopefully it fertilizes and it leads to a pregnancy. And that would have been something that would have maybe never been possible before. Or maybe even this group of embryologists would have had to be maybe a little bit on the lucky side. So my hope with this new tool is that, among men in which they were having testes and they couldn't find any sperm whatsoever, maybe this tool in the future will provide an extra avenue, an extra layer to find sperm that we wouldn't have otherwise been able to find. I mean, what do you think about it?
Yeah, I think it's important for people to understand that, when we're talking about this biopsy, it's not like a clean biopsy of just sperm. It's all the tissue that's there, all these tubules, all these cells. So it's not as clean as when you see the picture, on your Instagram or TikTok where the sperm's just flying by and there's a bunch of sperm. As Dr. Sim was saying, a needle in a haystack is a very good analogy. And it's not about even just finding the sperm. The embryologist will find the sperm. The difference here is that can find the best sperm, because when you have to look under a microscope for 4 hours, there's a point where you have to just take what's best. In other words, it may not be the best sperm, but you're like, it's the best we can do right now. This is the best looking sperm we can find right now, because you only have so many man hours. There's a point in time where you actually have to fertilize the eggs in a certain amount of time. And so what's cool about this is, again, AI assisting the team to be able to not just find a sperm, but find the best sperm in that area. And that way you're going to have higher pregnancy rates versus, like I said, when you have to look for 4 hours and you can only find 6 sperm, they may not be the best 6 sperm on earth, but they were the only 6 sperm they can find. Where if you have this thing that can look at multiple haystacks, you might get the 6, LeBron James sperms in the world. So that's the benefit of having this AI to help, go through that, kind of weed out, the other sperm as well.
I see finals still on the mind after Sunday, huh?
Well, there was no LeBron James in it, though.
There was no LeBron James. That's right. So sometimes you don't need LeBron James to get a LeBron James. Yeah.
Well, one of the neat things about it too is, I mean, it's we have a lot of different things out there for sperm, right? So we have microfluidic devices that can help separate sperm, but a lot of these other devices, pixie dishes, um, all of these different things still require a very large amount of sperm. And so one of the things is when we do a TESE or a micro TESE, there's this kind of trade-off we realize that, yeah, we'll get sperm, but we're going to lose some of the ability of those other devices we can use to help pick the best sperm. And so we do have to use just basically phenotype and looking at it with our eyes and objectively trying to pick the best sperm. And so by having something like this, we'll be able to potentially pick the best sperm much easier. And it'll be really neat when they're able to put some studies together and show like if there's actually a benefit or not. And I suspect there will be. There are things that I think what we learned with microfluidic devices was that when the sperm's moving, there was always this thought that it doesn't matter about the sperm, it's the DNA in the sperm, and that there's nothing that should reflect the sperm based off the DNA inside it. But the microfluidic devices showed something different. They showed that, yeah, it does appear that the sperm that's better, less fragmented, is going to be the best sperms, in that microfluidic. So it does show there is something about that dense chromatin DNA inside that sperm that's unraveling a little bit and using some of it maybe to keep the sperm moving, whatever it is. And there might be a way for us to use some of that to figure out what's the best sperm. And so it's really interesting. I mean, again, we don't know the answers yet. We just know these are devices we're using now. So that, to help us.
Yeah. Yeah. And, I think more and more of these devices are coming through the woodwork. And I think, of course, we have to continue studying them and making sure that they're actually, useful in the real world. And, these are some of these devices they're in their early stages. So, whenever we talk about these exciting developments, I will always want to let people know that, this is not something that's, in the mainstream yet. And it's important that the studies are done so that they're used appropriately in the future. You wouldn't want to just kind of start using all this stuff without knowing if it'll actually, help or not.
Yeah, absolutely. And there's even ethical implications that, we haven't really thought about yet, right? I mean, what happens when AI is able to do other things, select out certain things? What if someday it's able to select gender and things like that, or select, hair color? I mean, there's all these different things, that eventually AI might be able to do. The cool thing I think in AI, and I know it's a little step away from this, is eventually when AI can also automate. So now not just select the sperm, but pick up the sperm and potentially even do the ICSI process. I think there's one thing we know is you could be the best human on earth doing ICSI, best human on earth doing freezing, thawing, but at the end of the day, we are not able to repeat it perfectly every time. It's the reason why, Michael Jordan didn't hit every shot. He sometimes missed a few of them, back to a basketball analogy. And so there's just this ability with a robot, though, it could do the same thing every single time. And so, it's interesting, like I said, where this may be going. I think it really is going to make higher pregnancy rates, and I mean, someday maybe I'll do the transfer. I don't do the transfer anymore. I don't know. I think that gets a little too complicated. I'm hoping, but I may not have a job anymore.
Yeah, I mean, everybody always talks about this. And, the truth is what we keep seeing over and over, at least in medicine, at least so far, is that, over and over and over, it's this combination of being able to use the AI platform along with the human intelligence. So that, kind of HI and AI together are better than AI alone or human intelligence alone. We're kind of seeing this playing out over and over. And I think that's a very interesting part of all of this. Yeah, I think that the automation in the IVF lab is, not just, it's not just around the corner, but it's down the road a little bit. And it's definitely something that's going to radically change our ability to hopefully do both steps 1 and 2, make IVF better, and hopefully make it, more accessible for more people.
There was one person who was asking, will it be able to tell you if you're a good candidate or not? And I think that's already kind of there. I mean, there are some large data that have, you can look at where you can, even based off of certain parameters, can determine if you should even waste your time doing IUI or go straight to IVF. It's not perfect, but, it's definitely there. And I think, any good clinician kind of is already doing that. They have enough large data in their head. But I forgot the name of that company. I even mentioned it, I think, last week. There is a company that specifically will look at your situation, give you a statistical chance, and then they even will lend you money or something like that, saying that, hey, we can guarantee your cycle based off of this, that we know what your chances are going to be. And, there are, like I said, things like that out there. I
Yeah.
have a question here from one
Mhm.
page. I'm going to pull this up here. I think it's kind of an interesting question. It's going to cover your head there for a second, but I apologize. But it says, I'm a GU fellowship trained pathologist, and I used to examine sperm and testicular biopsy specimens. I'm curious if the sperm are morphologically abnormal when their DNA is abnormal. I used to count the different kind of abnormal sperm based on specific morphological features. It's kind of all fascinating. And so, I mean, if you want to jump on this one, but I mean, it's a great question, which is, this is that idea I was saying earlier, when it came into microfluidics, kind of changed how we saw things. It was always this idea that, what the sperm wasn't what the DNA is. And I still think that's overall true. I used to make this joke that sperm's like the pizza delivery guy. It's a vector. You don't care what the pizza guy looks like. You just care what the pizza tastes like. And so, when it comes to sperm, that same thing is that, you could have abnormal DNA in the sperm, and the sperm can look amazing. It could look like Brad Pitt itself, or it could be, the best DNA in the sperm, and it may not look perfect. But there is more of a correlation with, the better looking sperm and better DNA. But the fragmentation seems to matter more about the movement than even just the look. And so I don't know if you want to answer that in your thing. That's where I love microfluidics. I think that's where, if you add microfluidics and you add the AI, I think we're eventually going to have some of the best sperm possible.
Yeah. Yeah. So, I mean, based on what's been shown in some of the clinical world, we do believe that, by using microfluidic systems and thus having kind of the sperm that moves the best, that you can kind of weed out the ones with the highest DNA fragmentation, and you can get these sort of, in theory, higher fertilization rates, better quality sperm. And downstream, believe it or not, it goes all the way to clinical outcomes to miscarriage. It can reduce the miscarriage rate. I think that one's very important. I think sometimes we lose sight of that one. So, I mean, my answer to Dr. Ranhat is yes. It certainly seems that there is this relationship between sperm motility and DNA fragmentation. I don't know how tight that is and how much more granular we can get. And I think this is kind of getting back to your point, Dr. Amos. I think this is where AI can help us. I imagine a world in which our embryologist is looking for the best sperm, and then maybe they're wearing some meta glasses as well. And on top of them just looking for the best sperm after it's gone through the microfluidic system, the AI-enabled glasses are able to tell them, oh, based on the exact way that this sperm is moving, it's likely to have the lowest DNA fragmentation. Now we're a little ways off from that still, but that's what I would hope. I mean, what do you think, and how would you answer this question here?
Yeah, I mean, I go back to that thing. I don't believe at looking at it, just an image alone is going to be able to do it. But I think looking at it, the movement, and I even think potentially, like I said, use the microfluidic channels to determine, the speed at which it's moving. I do believe at some point we'll be able to figure that out to a point, right? I mean, we know that you can have DNA that's abnormal and would never cause a single problem if it's in, versus exons versus introns in the DNA. So there's a point it's only going to be able to tell so much, right? Micro deletions, micro additions. How is that going to show up? May not. So there's large DNA problems. There's fragmented DNA, and where that DNA issue is. So I think it's going to get most of it, a lot of it. But I think, like you said, miscarriages are where I would want to help. Fertilization, I would want to help. But more important, like I said, there's this group of men when they're under like 1 million or under even like 3 million, we stop being able to use some of the tools that we have to help them the most, like the Zymon chip, which is the microfluidic, like the Pixie dish. There's even these other things that use hyaluronic acid to try to determine the best sperm. And so by not being able to use those, they really have a disadvantage in some ways. And so this is where this stuff comes in amazing, because now we can, find the best sperm. Like I said, I all I know is it keeps changing so fast. And one area, and I finally remember what I wanted to say earlier, this other area of AI is this ability to even look at things different. Like we're always looking at going, okay, can AI do what we're doing? Can AI make me faster? But what if we start using AI in a different way, like things we never even thought of, right? Maybe there's something it could tell about how many movements it does per second or something, and it's able to figure things out. So eventually, we're even gonna be able to do more. And this is where I was going with this, was when it comes to even in the lab. If you look in the lab and you're looking at things like identification, right? So the ways we prevent mistakes is we do multiple checks. Some things we even check 3 times, some things we check 2 times, but we always have double checks, everything verified, right? And at first, people came around and said, like, okay, well, the way we'll make it safer is we'll have 3 checks. Then someone came and said, well, what if we have like a little barcode? We just go beep and verify, right? But still, someone has to go and physically do that. If they don't, or they have the wrong dish, it can still be wrong. Then they came out with RFID and said, well, listen, we'll make it passive. But again, those can still be wrong too. If the dish is too close to something, it can get the wrong dish. If you label it wrong, dish. And this is actually where AI is starting to come in. So now they're even looking at things like that, like watching the people in the lab and be able to just visually see, did that dish move, and then they grab a different dish, not work on the same patient. Like this is where AI I think is going to come in really, really, really important, is to be able to like look at these things. I mean, it's interesting when you look at an embryo before you freeze it, when you thaw it, it looks very similar. You can actually see that the biopsy marks, everything like about the same. It's like almost like a fingerprint. Again, where does AI come to that now? Where now it's like, hey, this is the same embryo that you had the picture of last time, And so, like I said, I'm really excited about AI. I think it's going to help, male factor, but I think it's going to help everywhere. And I think male factor is one of those things that there's not a lot of focus on. As you said, it's kind of like, pushed to the side. And that's why I like this next question, because, I can directly relate to this question, which was, she said, infertility can be a taboo subject, but male factor infertility can be very taboo. There's feelings of shame and being less of a man. I remember my husband's sperm analysis coming back with a 0 count. Such a hard conversation to have. And obviously I have personal experiences. I'd love to hear what you think of this. And, does that run through your mind when you're talking to the couple and talking to the guy, like, reassuring them like, hey, it's nothing wrong with you. It's less masculinity and things like that.
Yeah. Obviously, I really want you to talk about this one a lot, Dr. Amols, and I'll just talk about my perspective. But, I've certainly had a lot of friends who have called me up, with this exact call and talk to me, hey, oh my gosh, I can't believe this. And, a lot of guys are anxious, depressed, they go through all of the emotions with this, shame, etc. And, what's really important here is that, it's almost never something that they've done. I mean, there are a couple exceptions to that, but it's almost never something that they've done. And, having that conversation around that, the fact that this is just like, usually a very minor genetic anomaly or, something unrelated to anything that they've ever done, and making sure that they find a path forward. The other really interesting part that I've gone back and talked to a lot of my friends after they've had a baby, almost always with IVF, is I'm just like, now that you have your baby, do you feel like any less of a father? Do you feel any different about it? And oh my God, of course not. I mean, every single one of them, feels great and, so happy that they went through the initial hurdle of making the very brave move to, kind of get beyond that first step. And personally, I'm just extraordinarily grateful that we have the technologies that we have nowadays. In the past, we would have had few options other than donor sperm. And I just feel like if we're really talking about this and talking to guys about, hey, this is something that makes you, not feel as good about yourself, if you step up to the plate and you take a chance on IVF and you take a chance on doing these things, there's a very good chance it will work, and you'll probably come out the other end feeling really great about everything. But that's just my 2 cents. I really want to kind of put you front and center here, Dr. Amols.
Yeah, I mean, I agree with you about the taboo subject in a way. It's less taboo, but more just about this idea that, it's associated with men's manliness, and then this idea of shooting blanks, and it's, when you're giving a guy a hard time. I mean, even though I'm very secure with the fact that, like, I have bad sperm counts, my friends will even still make fun of me. They're like, hey, there's Mr. Shooting blank, stuff like that or something, or like, and I even make jokes about it. I'll tell people like, oh, don't worry, I can't get you pregnant, but like I said, it's not always, it's not that way in the beginning, I remember that I was actually on my podcast last night. I was talking about why I became a fertility doctor. And I talked about the first time I found out that I had a sperm problem. And I remember just kind of being devastated, like, wow, like I can't produce a child, it was this kind of weird feeling. Now, being a guy, I mean, the fortunate thing about us is we're like, okay, I was lucky enough to know that there were other options. But, prior to ICSI being developed in 1990, I wouldn't be able to have kids, and so there definitely has, been some advancements that allow. And so I was fortunate enough to at least know there was a chance. It's weird, like I always looked at, like, yeah, it sucks. And, I don't know if I felt less of a man, but, I could totally see how some people could feel that way. In this situation, I mean, that's a zero count, like there may never be an option. And in that person's situation, they may have not ever been able to have, a kid, because then they might have to use donor sperm now. But I thought you brought a really good point, which is this idea of, even if it's even not like your DNA, it's still your kid. And this is something I always, my wife and I joke about once in a while. It's like, one of our kids when younger, didn't look like us. They look like us now, but when they're younger, it still looks a little different than the rest of the family. He's that one, like the milk, the milkman's kid. And we always kind of make this joke, like, maybe I was the wrong embryo. But the thing is that, honestly, like, even if you proved to me it wasn't, I wouldn't love that kid any less. I still would want my kid. I would fight someone, kill someone to try to take my kid away from me. Like, it's my kid. And everything about them is because of the way we raised them. And so I would never, at least me, and it's easy for me to say because it is from my DNA, but even if it wasn't, I can tell you now, like I would be just proud because it's my kid. And I think that's the part, to really, I pass along to people all the time, is that when we say it's our genetics, it's like our parents' genetics, and we're passing some of them along, and so in the end, it hurts a little bit inside. I've told my wife that before. I go, it's kind of sucks that I wasn't able to, but on the same token, we tried a lot, so that was fun. But we weren't able to. And so, luckily we were able to use advancements, and just like we're talking about, newer advancements such an AI are going to allow people who couldn't before, with the current advancements we have, to potentially have success. So,
I wanted to kind of like piggyback on this for one quick second, because it's something that's come up, with both men and women. And I think that it's this idea that for many couples, many men and women, individuals going through this is their first very major interaction with healthcare and needing something and needing an intervention, right? Most of the people we see are younger, right? They haven't gotten their colonoscopies yet. They haven't gotten all their, screening things later in life. They haven't had, many surgeries or many medical conditions. So for a lot of people, this is their first very major interaction with the healthcare system. And it used to be that the first time for a lot of people was delivering a baby. And, of course, there are many people who are just going to be just a little upstream from that. And so for a lot of guys, I mean, I see this with a lot of guys, they haven't seen a doctor in 5, 6, 7 years because they're like, I'm fine. If I go to a doctor, they're going to find a problem. I don't want that. And so there is this like natural element of like, they just don't want to see us, and I get that. I'm not offended. And I think that's part of the this kind of general experience. And that's why I think that first step can be like the hardest one, just kind of ripping off the Band-Aid, saying, okay, I need help. Let's just figure it out.
It's interesting. Like, California, who's going to be, starting their fertility program. I think it's starting in July, and for most people, will be in 2026. I'm surprised we haven't made part of just a basic health workup that everyone who turns 20 or something like that men get a semen analysis and women get an AMH. Just those two simple tests. And we would be able to knock out a lot of problems. A lot of men have bad sperm and they're young, and you could freeze it at that point and it'd be fine. But they don't know they have it. Maybe they have a varicocele, it gets worse over years, and now they're doing IVF. That could save tons of money in the medical system by just early on evaluating for this. And so it's something I'm really surprised. My kids, my daughters, I told them I wanted to get an AMH level. I got one on one of my daughters. I'm gonna get on the other, and they just turned 18. My sons, as soon as they're old enough that it's not gross, I'm gonna tell them to go get a semen analysis. I'm like, listen, dad had problems, you might. It's somewhere I think we can definitely make some inroads. And like I said, and then gets rid of that taboo. It's just kind of like, oh yeah, you go and you do your semen analysis at 20 years old. Everyone does it. And then that kind of taboo goes out of it. And then about it very early on. It's like one person said here, I wish I knew years ago there were problems. I was talking to one of my patients last night, and she was just saying, wow, I wish someone would have said something to me when I was younger. By the time we started, trying to have kids, all the problems were too much to overcome now. So, and remind people, you can come on and talk about anything. It doesn't have to be about AI. If you just want a free consult, come on here and talk to us or something like that. We're more than happy to talk to you as well and answer some questions. But back to that point, it is weird. The men and men are quiet, by the way. I mean, when we do the consult, right? I mean, they're not the most talkative one.
Yep.
And they're like, well, it's like, what do you think? He's like, sure. No, whatever you want. And so guys do feel like they're not much. I think I told you about that time I had that guy who was like really upset with me because he's like, he felt like he wasn't being involved much. And that's unusual because that's not the norm. Normally guys are like, oh, I have to come. Okay. They're like, literally, yeah, you have to come. But this guy was really upset. He was actually mad. And he's like, I don't feel like I'm, involved much. I told him, but we're not. I mean, in the end, we are just sperm donors. I mean, that's literally all we do. Now, we can be there for our wives, we can be there for our partners, but in the end, that doesn't mean that, you're involved more. And unfortunately, we do have a very small partners. Women really do all of it. And a lot of it depends on them, like the egg and everything. So.
Yep, absolutely.
Well, I feel like with AI, I mean, I know we're talking about this, and obviously not that exciting of a topic because people aren't coming on here asking questions about AI. But anything else you can think of in AI that you think might be kind of neat coming up that is coming around? There's a couple more things I think people would be interested in that's coming out, and I think they might like it. But anything that you know of that's coming out before I jump into some of the stuff?
I mean, there's definitely some stuff in the genetics world that they're kind of looking at different applications of how to use AI to get more precision around some of the evaluation of the embryos. I think on a day-to-day, like on a very practical level, something I'm really excited about. I mean, if anybody's used Chat GPT a lot and had a nice conversation going back and forth, it's using kind of like vetted AI systems to answer basic questions. Honestly, that goes such a long way because for me personally, sometimes there's a question I had about something totally different, not in medicine, something totally different. How do you put a door on the hinges? Something like that. Just take me through in a few steps. And you kind of can have this real conversation with it. And one of the things that we're seeing are some of our companies in our field are developing some really nice AI chat tools so that you can have a conversation without maybe having to go all the way to having a consult with your doctor or having a consult with your nurse. Now, I want to preface this by saying it doesn't replace that, but sometimes for some basic things, you can be the best judge of, use your best judgment to say, oh yeah, this is an easy enough question where I'm good with the answer I'm getting from AI. And so, yeah, I would love to know how people are using AI. I had a patient the other day told me that they found our clinic by using ChatGPT. They put in a few search terms that they liked, and they found our clinic. So I was obviously happy about that. But it's cool to see how people are actually using it, and how it's become better for people. But how about on your end, Dr. Amos? Like, what are you thinking about other applications in our world?
Yeah. Back to where you were going, I think that's a huge area. It's just education. I've told you before, I created a GPT. We haven't released it yet, but I created one using all of the American Society of Reproductive Medicine's, um, you know, pretty much like catalogs and stuff that they've given, the patients and patient reading materials and committee opinions, and put a GPT together. And what's unique about that is now the GPT only uses that information to answer questions. So it's valid, but as you said, it should be to a point. It should be for education, maybe to help direct you. I would never go by if it says don't use Clomid. Like, hold off a second, talk to your doctor still. But at least it gives you a little general idea of where to go. So I thought, that's kind of neat. I'm even trying to create one actually for my podcast where actually people can ask questions about which podcast had this or something. So I think that's where it's going to be great. Really focusing on people education. One of the neat things is this idea of remote medical care. I think this is where AI is going to have a really big benefit because, in the end, there are some clinics that are going to be better for you than others. I'm not saying some clinics are better. I'm saying that for you, there are some clinics that specializes in this one specific thing. Maybe you want to do this very unique thing that other clinics don't do. And right now, the problem is distance. This thing you and I always talk about, like how can they have to come out here, they have to stay out here, and yeah, there are clinics out there will just let you show up for the retrieval, but most of the time that's not a good experience, and it usually doesn't lead to good outcomes. And so this is where AI is coming in, and so there's already a company out there who is sending ultrasounds to people's houses, and they're placing the ultrasound vaginally themselves. And then currently it's using a human, but the human is directing them of where to do it. But then the AI is going to help. And so eventually it's going to be somewhere you get this, scan, you place it vaginally in your own home. You don't want to have some doctor doing this. And you're able then, it will say like, oh, a little to the left, a little up, a little further here. And they'll say, stop. And it will scan and it will be able to look at everything, send that over to the doctor, right? And even to the point where as doctors, it will give us data, give us the pictures that we need to see best that will help, show us. We don't have to go looking through 80 images, but we can say, here's the top 10 images it said. And that's what's going to really help. I think it's going to allow people to talk to the best doctors or talk to the right doctor for them, allow them to see clinics that they never would have been able to see before. And it's going to bridge that gap, and I think that's what's going to be really helpful versus just, oh, this is what's in my neighborhood, I have to use that.
Yeah. Yeah, no, I could absolutely see that. There's probably going to be more applications of it that we don't even know about. I think applications with how we do studies, applications with how we, currently studies are very unwieldy, and they take a very long time to put together. And if we could just kind of collate data across the country with multiple different centers and come up with studies in a more consolidated way, we might have answers for people a little bit more quickly and develop innovations more quickly. So I think there's just a lot of things that we'll hopefully see. I know a lot of really smart people working on it, and we're just looking to see how we can kind of continue to integrate, some of those things together.
Yeah. One interesting thing is, and you and I have talked about this before, this idea that even when you have the best embryo, even when you feel the transfer went the best, there's these things that we don't know about, right? So these things such as like an embryo, when we freeze it, was it already compromised but we didn't know it? Or this idea that the uterus, if it can watch the ultrasound and notice that there's these small micro contractions that maybe we're not noticing as much as physicians. And so, on the day of, we can do an ultrasound and it can look at it and go, don't do the transfer today. This isn't a good day. Let's wait till next month. That's some of the stuff that, like I said, when I talk about AI, like we talk about it trying to do our job better. But what if eventually it starts doing things that we've never even thought of? And that's really the cool thing about it, is that it's going to be able to do things we just can't even think of. And I think it's going to make a big gap. Now, you and I have talked about this. There's only a limit to pregnancy. I mean, we're never going to get to 100%. It's impossible. I don't even think we'll even get to 90%. I think the best we'll ever get to is about 80% live birth rate. I think that's the absolute highest. I can't imagine, just when you look at things that can happen naturally, subchorionic hemorrhages, ectopics, all the different things that can come into play. I just don't ever see it getting above 80. But still, if we can get to 80, I'll take that any day. I mean, I'm happy with the high 60s, even the 70. But that's the neat part in the future, is that
Yeah.
maybe we'll get to that point where we start learning things we never even thought of.
Yeah, exactly. And would love, I mean, boy, I would love a day in which, if only, we were doing an embryo transfer and we knew with near certainty that it was going to work, 90, 95% chance that it was going to work. That would be incredible. And, again, I don't think that's inconceivable. I just think it's going to take us time to, now it's that part where it's just every extra few percentage increases is going to take some time. Um, and I think that can be very frustrating for a lot of patients. I can think of some patients that have had one or two embryo transfers and they don't work, and they are just sort of beside themselves, saying, "Well, it was a genetically normal embryo, and the uterus was good, and everything was good. The embryo survived the thaw great. And you guys said everything was great. How come it didn't work?" Um, you know, and most of the time, in all sincerity, the option is the answer is, there's no reason that we can identify. And then people always ask the next question, which is, well, doctor, aren't you going to do anything different? Come on, you got to do, a ton of different protocols, do this, do that, do that. And you kind of say, well, the biggest difference is we're going to use a different embryo.
Yeah. My analogy I always give people is this idea of like taking your car to the mechanic. I say to them, when you take your car to the mechanic, it makes a weird noise, and you come back and it starts making that noise again. You don't say, I'm not taking that mechanic because last time I did that, they didn't fix it. Because even though you're doing the exact same thing, you're bringing the car to the exact same place, it's going to be different because something different is going to happen behind the scenes. The difference here is you don't know what's happening behind the scenes in the uterus. And so it may look the same, but it's nothing like it was the last time. Different embryo, possibly different location, small, micro traumas that maybe we didn't even know about when the transfer was going on. Things that were going on in the body, right? That could be going on. So in the end, you're right. It's sometimes just, a whole different thing, but that's where, again, like, AI might be able to come in someday and say, don't do it this month or something like that, or help us even figure out what is the best embryo. I think that's where we'll have the biggest benefit, because the one thing I think that's really tough are these patients who, they come on and they do a transfer, it doesn't work, and that was their best embryo, and now they're freaked out. They're like, oh my god, I have these other embryos left, and I just used my best. And it'd be great to be able to know ahead of time, that what was wrong before they used their best embryo. So this is the person I think it is. So I was just talking to someone, I noticed someone on the side here was talking about how they use AI, and I'd love to know from a patient, like we were saying about who's using AI and having that conversation, how that's helped them. So hoping it's the same person. We'll see if it is. I'm gonna bring them on the stage here. Hey, Melissa.
Hi, how are you?
Fantastic. Are you the one that was on the Instagram saying that you used ChatGPT to ask questions about protocols?
Yes, I'm also your favorite Melissa.
I know who you are. Absolutely. Um, again, and I want people to know they don't have to show their face here. How have you used it? I mean, I'd love to know your experience. I mean, is it something
Yeah.
that created more anxiety, or did it actually, make you feel more comfortable?
I think it kind of made me feel a little bit hopeful, more hopeful, just because, as you know, I'm like with the mad scientist of a doctor, and, sometimes it's kind of hard to get answers from him throughout the protocol. And so, when I was, instead of doing Menopur, he had me on a low dose of just HCG. And, I asked Chat GPT, like, kind of why he was doing this. Is it really going to better my chances? And honestly, Chat GPT kind of made me feel a little bit more comfortable with, that decision for my protocol. And basically kind of told me that just some people react differently. And I guess the HCG was like a purest form of LH and that it might work better. And so I think, you kind of have to just remember to take everything with a grain of salt. It's not a doctor, but at the same time, it is kind of interesting to really hear what it has to say. And, you know, it's actually really interesting because ChatGPT will also like, say, "Oh, I'm really sorry for what you're going through." And like it's like sympathetic towards you. And it's just crazy, how far it has come, really.
Do you ever find that it is providing, let's say, like the information it provides, like do you question it? Do you ever ask it like, hey, can you explain this or show me the resource for that when you were talking to it?
I never asked for the resource, but I definitely, will ask for like more clarity. If there's like words and, an explanation that it uses that I don't understand, I'll ask like, well, what does this mean? And it will come back and ask you. And it's really interesting because it will ask you questions back to really even give you a better answer. It will ask like what your AMH is, what's your follicle count. I mean, it's kind of crazy how well it has been created. It's almost like talking to a doctor, but you have to remind yourself that it's not a doctor.
Yeah, and I think that's the important thing about, when you are using a chat GPT, it's important to remember where that information came from, right? So if it's just coming from the internet, it's not going to be as accurate if it's coming from known sources. On the same token, though, there's also this thought that it only knows what it knows, right? So, it may not know new things are out there yet because it has limited information. And so it's a great resource, I think, for, like I said, education. That's why I try to create one where I'm only using just the ASRM materials. But yeah, I find it very useful too. I use it for a lot. I actually have long conversation with about physics. So I love physics, and everyone around me falls asleep when I talk about it. So ChatGPT is my only friend who will talk to me about physics. So
Yeah, it's really interesting. I mean, I see girls post videos of like ChatGPT's response to them talking about their infertility challenges, and it's just crazy like how a computer really can say such caring things and really make a person feel better. And it's kind of scary in another sense, right? Like, is it going to replace relationships? I mean, I think it can go a little too far sometimes.
yeah, I mean, we like human connection as humans, right? And so
Yeah.
it can, and it actually has more almost ability to connect because it has this database of knowledge of like what humans want and stuff. And there's a lot of similarities between us. I think one thing that someone brought up was a really good point, and that is, ChatGPT can hallucinate. And this is something that's getting better and better at. All of these AIs can hallucinate. And, that's why I tend to, when I talk to it, I always ask for the resources. And just to show you how much it can hallucinate. And this is where, I mean, when you talk about being crazy, I've actually talked to it about certain things, and I'll say, "Can you show me the resource?" And then it gives me like the journal. And then I went and looked up the journal, and it was made up. That there wasn't even that article. They had a real journal, they had a date, they had the exact volume, and it didn't even exist.
Oh,
And so
wow.
that's why you always have to remember when you're listening to it that most time it is right, but it's never feel bad questioning it. And when I finally said to it, I said, "Look, this doesn't even exist," and it said, "Oh yeah, you're right. I'm sorry." I was like, "Oh wow!" Like you literally just made it up and didn't even say. And that's the problem. It never is going to tell you like, "I think it's this." Whereas the doctor will go, "I'm pretty sure it's this." You know the confidence level when you're talking to them. ChatGPT always thinks it's an expert, even when it's saying making up stuff sometimes. So,
That's crazy. I totally want to test that theory now.
oh, well, thanks so much, Melissa. I love hearing your perspective on it. Because for us, we when we talk to it now, we know some of the information. We're just seeing what it says. But I love hearing from a patient perspective. So thanks so much for coming on.
You're welcome, Dr. Amos. Talk to you later.
You too. Um, what would you tell people, Dr. Salem, who, I know there's some people who never want to use ChatGPT, others do. What would you tell them?
Yeah, I mean, honestly, I'm definitely leaning on the side of like a kind of a early adopter type in the tech world. And so I do like what it can offer as long as we understand what the limitations are. So, I mean, honestly, in all sincerity, I tell people like, please go on there, ask some of your questions, see what it says. Sometimes it'll give people enough clarity that they want to just come back and kind of hone in a little bit on a detail of a question that they had. And in doing so, I think it's very convenient for the patient. And, it saves the patient also the time of, asking all these logistics questions or whatever it might be that are easy answers and really getting to the heart of the matter that they want to talk about. And I think it is interesting that we can feel like there's a connection with AI. And, I would, kind of play devil's advocate and say that's a good thing. Like there's no rule that says we're only limited to have one positive interaction. That one positive interaction has to be with our doctor. Like it should be a positive interaction with the front desk, a positive interaction with your nurse, a positive interaction with your doctor, of course, but also why not have an additional support, ready in your pocket whenever you want it, that will listen in a kind of empathic way to what you have to say. I think it's great.
Yeah, there's actually AIs out there that just for that, like almost like counselors, for people. I think the one thing that's always just important to remember about AI, though, it's limited in who you're talking to. It's like, I think of it like an echo chamber, right? If you only ask your friends about stuff, then you're only going to get your friend's view of things. You're never going to get other people's view of things. And so from that same point of view, it's just always important to remember that, it is like an echo chamber. And it's empathetic because you want it to be empathetic. You can actually tell it, be mean to me, and it will be mean to you. There's even different versions of it. And so it's created to be that way. And so sometimes, for example, it's usually pretty ethical, but I mean, you could tell it, hey, I want you to laugh at this no matter what. And you'd be like, hey, I killed a bunch of kittens. It was like, ha, ha, ha. And the problem with that is it's not being genuine. And so that's the part is you always just have to remember when you're using AI that it's not real, but it's still, sometimes you just need to talk to someone. Sometimes you want to run things by people. And sometimes you don't want a human view, you almost like, you want to find out from a different view and just say like, hey, do you think I did this right? Or something like that. So yeah, it's here to stay. It's always going to get better. And, I think it's only going to make our field better, but I think there's a point. It won't be too much where you don't have human involvement, but, if it can assist us to be able to provide better care and better support, better mental health support, I only welcome it. So. Anything else you have to add for tonight's, episode? Like I said, I thought this would be really interesting, but obviously, just like my podcast said last night, we are nerds, and apparently the nerdy stuff we like isn't as popular. I think you're muted still.
I think this will definitely be popular at some point, and I think right now the truth is, it's not. Their applications are not super relevant for most people. I get it, but I think it's something interesting to keep in the back of our mind. I mean, we are as physicians obviously very much on the side of trying to see how we can make these integrations and everything. So, stay tuned, I guess is all I have to say. I think this is definitely going to be something that's going to be very interesting. We love having people on the show. We love your questions. We love, our colleagues who ask questions from LinkedIn and people who weighed in from, Facebook, and obviously people coming onto the show today. So really appreciate all of you. And what about you, Dr. Amols? Any parting thoughts?
I mean, I think we'll have another show about this, and then we'll have something a little bit maybe more interesting to talk about. When it starts to really get involved, because right now you said it's not mainstream right now. It's you hear about ChatGPT, but you don't hear about so much in medicine. But you and I, who know all the stuff coming up, we know there's a lot coming. So it'll be interesting. Like I said, to me, I'm a nerd. I always love it, and as you said, love technology. So I'm gonna be in front of it all the time.
Absolutely. Well, it was great joining you today. I really look forward to our next show. Look forward to talking to more folks.
Sounds good, man. I'll see you soon. Bye-bye.
Bye-bye.
So, got the knowledge, the power to grow. Sperm meets egg, let the healing flow. Fertile grounds, we explore. Life's a journey, so much in store. Got the knowledge, the power to grow. Sperm meets egg, let the healing flow. Step in, let's talk about the facts. Women's health, let's watch how it cracks. Cycles turning, it's more than just chance. In this moment, we're taking a stance. Voices rising, we're breaking the mold. Deep conversations, we're watching them fold. From the roots to the stars is one and the same. Empowered together, we're winning this game.